I'm Ellie, and today my observation was dialysis. So, the role of the dialysis nurse is to provide care support to patients suffering from kidney failure. These nurses provide support, medication, and monitor patients throughout dialysis. They also educate them on kidney disease and lab values. So, the responsibility of the nurses during this experience that I saw, the techs played a huge role at the beginning of the day. They were in charge of getting all the machines primed and ready for the patients to arrive onto the floor. The nurses also helped out with priming too, machines. But then the nurses and techs worked together throughout the day, um, worked together with getting vitals because each patient had to get vitals done before treatment was given. And then after treatment started, you had to get vitals every 5 to 15 minutes after starting it. It just kind of depended on the blood pressure of that patient. So we check the blood pressure so often because once treatment starts, the blood pressure drops because we were pulling so much fluid from the heart so quickly. The nurse also has to look after the labs to see what the patient's BUN and creatinine levels are before we start treatment also. So based off those levels, the nurse will use a sliding scale to see the amount of potassium that we are going to be using. So they also hook the patient up to, it's called a buffer electrolyte. So it's like these two big jugs at the bottom of the machine that these two lines go into, and that it kind of helps filter out the blood and get the toxins out. So the nurse is also in charge of keeping the sterile dressing free from infection. So if it ever gets soiled or anything like that, we are putting a new sterile dressing on it right away. So I was able to help out with a few vitals today, but I mainly observed, and the nurses were really good about teaching me different things about dialysis. So the nurses were really good about communicating with each other. The charge nurse was always called, or the charge nurse always called the nurse that was on the floor first before the patient arrived to see if she needed to know any information about this patient and different things like that. But the nurse also collaborated with the doctors on rounds, and they were always talking about the patient's next step, whether that was going home into the clinic to get treatment now, or just to see when their next treatment in the hospital would be. So, patient education. I was very surprised with how good the nurses educated their patients. So the nurse did an amazing job with describing all the steps. We had a new patient that came on to get dialysis, and this was his first time getting treatment. So he was very confused, like not confused, but was very concerned and asked a lot of questions throughout it. So he was wanting to know his labs and like what was bad and what should it be and different things like that and why they were low. And the nurse was really good about dumbing it down to like so he understood what they were talking about and different things like that and how it was affecting his body. And then the nurse also did a great job with describing the machine to the patient. So she showed him like, oh, this is where the blood's going. It's circulating here. This is like this little tube thing's acting as your kidney. And this is where all the bad toxins are getting taken out. And it was just kind of neat how she took the time to describe all these things to him. And then after, you could tell, like, after he got all those questions answered and stuff, he was a lot more calm. And the environment that these patients are in is a quiet, calm environment. Many patients sleep during it because it is such a long treatment. It takes about 4 hours. It kind of depends on patient and how they're tolerating it. So a nursing diagnosis that I saw today was imbalance of nutrition. And then another thing was risk for infection. So the imbalance nutrition one, she had a G tube and she wasn't really handling dialysis very well. So 2 days ago, she came in to the unit and she had to be taken off, or like they had to stop the treatment because her blood pressure dropped like into the 80s. And then that also happened again today. So she didn't receive like the full treatment that the doctors wanted her to. And then the other thing was risk for infection. And this was a pretty big thing because the nurse when one of the patients arrived to the unit, his dressing was all bloody by his catheter and stuff, and she was like, oh no, we need to get this changed right away. So she did a new sterile dressing change and everything like that. But it's also very important when they're hooking him up to dialysis that the nurse is wearing a gown, gloves, and a mask, and also the patient wears a mask too. And so this helps with keeping everything clean and sterile and different things like that. So would I have done anything differently? I don't think so. I feel like I did get the full effect and the full or experience that I wanted to out of this. So I thought it was very interesting to observe. I learned a lot about dialysis that I never knew about. And the fun fact of the day that I thought was very interesting was I learned that they use city water to help clean the blood with, and then the bad toxins go through this little hose. So they have like a back room, and it's like a hose that the water travels through, and like the bad toxins just go down the drain. So you can see all the bad toxins coming out into the drain. So I thought that was really awesome. I don't know, I didn't expect that at all. And then the water is checked before each treatment, and they're checking for like bleach, chlorine, and other things in the water that wouldn't be good for the body. And then I also got to talk to a travel nurse that was on the unit. So I thought that was very interesting to be able to talk to her. We asked her a lot of questions just about how she likes it, and she kind of gave me some pointers about nursing school and things like that. So that was kind of fun to talk to her. But my overall experience, I liked dialysis. I learned a ton that I didn't know about. There can be a lot of waiting around for like when the patient is receiving treatment, but the nurses were super nice and they made the atmosphere really fun. So that was a good thing. And my day went really quick. So that's always a good thing. Thank you.